I'm Dr. Sean Delaney, facial plastic surgeon from Houston, Texas, and I'd like to talk to you about the different types of brow lifts that we have. When we look at brow aging, usually when you look from inside to outside, the outside part of the brows have the least support and they tend to drop the soonest. And in fact, usually they manifest as hooding over your eye. We don't usually think about the eyebrows coming down, but usually this excess hooding that you have there is an indication that your brows have come down a little bit. Now, for men, it's acceptable for the brows to be kind of where the level of your eye sockets are. For women, ideally, they're either at the eye socket or slightly above. When they start coming down a little bit, you can look tired, you can look sad, you can look concerned, you don't look quite yourself. So the first thing we could do when addressing signs of brow aging is called a temple brow lift. What that does is it addresses out here in the temple region, usually where we have the earliest signs of aging. With a temple lift, what we're usually doing is using little incisions here and here to lift up the lateral portions of the brows to address that area. Next, if you have more advanced aging and the central portion of your brows have come down as well, then you want to lift across the board, because if you were to just lift outside, that may not be enough. In that case, usually we have the option of an endoscopic brow lift. With an endoscopic brow lift, we're using endoscope, so it's a little camera that's at the end of a rod that allows us to perform this procedure in a minimally invasive manner, so we don't have to use bigger incisions, so we can see what we're doing down there. So with an endoscopic brow lift, we usually have 5 small incisions, one here, one on each side here, and one here, allows us to lift the eyebrows as a whole upwards. Now, with an endoscopic brow lift, the one drawback is it does raise your hairline a little bit, because we are pulling the brows up and the skin's got to go somewhere. So an endoscopic brow lift is not as good of an option in those who have a tall forehead, much like myself. I do have a tall forehead. So if I were to get an endoscopic brow lift, my hairline would probably move back a little bit. So that brings me into our third brow lift option, a tracheal brow lift. A tracheal brow lift is a brow lift where we make an incision that follows your hairline. We make the incision in a regular fashion, so it's harder to see, and then curves back here. And so that allows you to pull up and lift the brows across the board. And because we are using an incision here, that actually permits the opportunity to help lower the hairline a little bit, or if not, maintain it. And so that's a better option for those who have a really tall forehead who also want a brow lift at the same time.